Hello, we are Senior Design Team 12, and our project title is An Alternative Method of Designing Accurate Pulse Oximeters for COVID-19 Patients. COVID is a respiratory disease caused by SARS-CoV-2. The virus is spread through respiratory droplets, and the symptoms occur 2 to 14 days after exposure. What we plan on doing is to perform market research and test the accuracy of pulse oximeters on the market. We will then compare that performance to a standard device such as a hospital-graded pulse oximeter, and with this information we will use it to give a recommendation on which device is best for detecting COVID-19. Common COVID symptoms are very similar to the flu. You will experience a fever, fatigue, headache, but what differentiates it from a normal flu is the lack of taste and the shortness of breath. Pulse oximeters can be available from Amazon to Walmart. It can even be available on your smartphone and wearable devices. So how do pulse oximeters work? This concept is known as Beer-Lambert's law. Beer's law is the absorbance proportional to the concentration, i.e. the red blood cells. Lambert's law is the absorbance proportional to the thickness, which is the finger in this case. As light passes through the finger, it measures the changes in the light absorption along with the color of the red blood cell to determine the concentration of a person's oxygen saturation percentage. So what were the devices that we used for testing?
The first pulse oximeter used was the hospital grade one we borrowed from Yukon Health. It is an Agilent Philips M3 patient monitor. We used the hospital grade pulse ox as baseline data to compare to the other oximeters. The next pulse ox we used is the WellU fingertip pulse oximeter. This is a Bluetooth model and is connected to an app called V Health. It was about $50 and it works very, very smoothly compared to the other ones. This model is the 3B Scientific Baseline Pulse Ox. This device is used for medical science education. It is $55. It is the most expensive pulse oximeter that we purchased. This is the Clinical Guard device and is designed specifically for sports and aviation enthusiasts. It is about $38 and was the third most expensive pulse ox that we purchased. The last one we purchased is the Walmart brand pulse oximeter. This was the cheapest pulse oximeter at about $8, sold in Walmarts everywhere. This device was very important as not everyone can afford expensive pulse oximeters, so cheap ones need to be tested for their accuracy as well. We used these specific devices for multiple reasons. First, we wanted multiple expensive models like the WellU and Baseline models so that we can compare them to more affordable models like the Walmart brand ones and middle tier price models like the Clinical Guard device. Most of the inexpensive pulse oximeters did not have good accuracy, which is not good as again, not everyone can afford expensive models, so the cheaper ones need to be as accurate as they can be. The final reason we use these models is because we wanted to use FDA approved ones, which naturally are more expensive. Our procedure is as follows. The first step was to measure the subject with the hospital grade pulse oximeter, as this was the baseline data we used to compare to the rest of them. The second step was to use a random number generator to choose the order we were going to use the pulse oximeters on each person. We had the following for the numbers when using the random number generator. WellU was number 1, Clinical was 2, the baseline was 3, and 4 was the Walmart brand one. The next step was to measure the data. We waited about 30 seconds between each trial. The final step is to record the age, height, weight, race, and any pre-existing conditions that they might have had, as this will influence our results.
So for our results of this 75-person sample, we ended up getting the WellU having the smallest percent error as well as the smallest standard deviation, followed by the baseline with the next percent error, and Clinical Guard, and last Walmart having the highest percent error and showing the most deviance from the monitor reading that we used as a standard. We also compared the pulse oximeters tested to each other by looking at the percent differences between the samples among the different pulse oxes. As it can be seen, the ones with Walmart show a higher percent difference between samples. Since we used an old monitor and the standard that we actually considered might have been inaccurate, it is important to take a look at this and see that the Walmart one shows a significant difference compared to the rest of them in terms of being less accurate. Both the price of the model and the inaccuracy reported by the percent error were standardized so that they could be used to compare the samples among different pulse oxes and with different factors. This table factors in expense score and inaccuracy scores at different weights to give different recommendation scores. The lower the recommendation score, as with the expense and inaccuracy score, it shows a more advantageous device at that option. The recommendation was just the sum of the inaccuracy score and the expense score weighted at different percentages. Looking solely at accuracy, the WellU pulse oximeter showed the best results. In terms of percent error and standard deviation, it minimized both. When looking at the different recommendation scores, when you weigh accuracy with more than 60.5% of the consideration, it is an option that we would recommend. However, with price also being in consideration, if price is over 39.5% of the consideration, the Walmart brand is the superior option. We understand that accuracy is the most important thing, but in less wealthy communities, it is important for them to have some sort of reading. And the Walmart one, although inaccurate compared to the other models, it does still have a relatively accurate reading, giving only a 1.23 average percent error. Using an outdated monitor and a blood saturation tool nearly identical to the pulse oximeters we were testing, it seems that we should take these results with a grain of salt. These results, while they do show that the fingertip pulse oxes are nearly as accurate as the monitors used in hospitals, do not necessarily show that they are as accurate as they need to be when it comes to reality. This may be affecting dark-skinned individuals more. In our experiment, we did not see any differences between any races or any vapors, smokers, or anything else. However, our sample size was small, so the significance behind this data is relatively limited.
We would like to give a special thanks to UConn Health, specifically Dr. Gould and Ellen for funding the project, and we would like to also thank Dr. Kruvermore for his advice and input throughout the project. Thank you.